Hello everyone, I am myself Dr. 𝐼𝐧𝐬𝐭𝐚𝐦. I am the general medicine educator. So in this session, I will be discussing a very important topic in the connective tissue disorders, that is the fibromyalgia. So if you see the definition of the fibromyalgia, it is a disorder which is characterized by chronic widespread musculoskeletal pain. Okay, so it is a disorder characterized by chronic widespread musculoskeletal pain. And along with this musculoskeletal pain, there will be also tenderness. Right, along with this musculoskeletal pain, there will be also tenderness in these individuals with fibromyalgia. And this pain or tenderness, it is present in the multiple sites in the body. I will discuss what are all the various sites. But in these patients with the fibromyalgia, let me tell you, along with the musculoskeletal pain, the individual will also have certain associated manifestations. So the question is, what are the associated features in patients with the fibromyalgia? A multiple choice question can be also asked on the same question. That is, all of the following are associated with fibromyalgia except the options are chronic fatigue syndrome, temporomandibular disorder, inflammatory bowel disorder, irritable bowel syndrome. Now, let me discuss all the associated manifestations and then come back to the same question. Although fibromyalgia is defined primarily as a pain syndrome, patients also commonly report the associated manifestations, and these associated manifestations include neuropsychological symptoms of fatigue, right? Neuropsychological symptoms of fatigue. Number two, the individual will have an unrefreshing sleep. Right, the individual will have an unrefreshing sleep, and apart from that, the patient will also have cognitive dysfunction, then followed by that, lastly, they'll have anxiety and as well as depression. Right, anxiety and depression. So these are the associated manifestations, and apart from that, these individuals will also have, you see here, patients with fibromyalgia have an increased prevalence of other syndromes associated with pain and fatigue. Now, what are those associated syndromes? That includes, number one, chronic fatigue syndrome, number two, temporomandibular disorder, then followed by that, lastly, the individual will also have chronic headache. Okay, so these are the other syndromes associated with the fibromyalgia, and apart from that, we have few more syndromes associated with the fibromyalgia. That includes irritable bowel syndrome, right? Not inflammatory bowel disease, it is irritable bowel syndrome. Then the individual can also have associated painful bladder syndrome, and lastly, they can also have other pelvic pain syndromes. Right, other pelvic pain syndromes. Okay, now this painful bladder syndrome, right, which is also called as interstitial cystitis. So these are the associated features in patients with the fibromyalgia. So along with the pain at multiple sites and tenderness at the multiple sites, these are the other associated features. So going back to the question, all of the following are associated with fibromyalgia except chronic fatigue syndrome, temporomandibular disorder, inflammatory bowel disease, irritable bowel syndrome. So the answer is the inflammatory bowel syndrome. It is not associated with the fibromyalgia. Now I said you that there will be tenderness, right? When you apply the pressure at multiple sites, you have the pain. And there is also a very important question on that particular tender points, that is, examiner may complete a tender point examination by thumbnail to exert the pressure. So how much amount of pressure has to be applied over the tender point in order to elicit that tenderness? 4 kg per meter square, 3 kg per meter square, 5 kg per meter square, 6 kg per meter square. Let me tell you, the pressure that has to be applied is around 4 kg per meter square, right? So that's a very important thing. Now, but what exactly is the pathogenesis? Why does this fibromyalgia develops? First of all, you need to know that this fibromyalgia, it is more common in females rather than males, right? It is more common in females rather than males, and the ratio is around 9:1. And this fibromyalgia, it is associated with a decreased cortisol response to stress, right? It is associated with decreased cortisol response to stress. That is one of the very important pathogenic feature. Okay, so cortisol response to stress is decreased. Normally, in a stressful scenarios, the cortisol levels increases, but here the cortisol response to stress is decreased and it is not increased in patients with the fibromyalgia, right? Now, then followed by that, if there is also associated decrease in cortisol releasing hormone. So, if you take the, how will you test that there is decreased cortisol response to stress? You need to check the urinary free cortisol levels. For suppose, if there is low free cortisol, right, low free cortisol and diminished cortisol releasing hormone in the urine samples, right? So in the sense, there is decreased urinary free cortisol and diminished cortisol releasing hormone, that will suggest an abnormal hypothalamic pituitary adrenal axis. Okay, so this will tell you that there is abnormal hypothalamic pituitary adrenal axis. Okay, so that will be the important pathogenesis in case of fibromyalgia. But let me tell you, apart from this important point, that is decreased cortisol response to stress, there are many other pathogenic features of fibromyalgia. Now, what are the other pathogenic features of the fibromyalgia? Number one, disruption of normal stage 4 sleep, right? So in stage 4, the individual will be in a state of NREM sleep, that is non-rapid eye movement sleep. So disturbed sleep has been implicated as a factor in pathogenesis. Okay, so disturbed sleep. Right, so disturbed sleep has been implicated as a factor in pathogenesis. That is, whenever the individual awakens, they will have unrefreshed sleep has been observed in most of the patients with the fibromyalgia. So, one of the very important pathogenic feature, that is disturbed sleep in stage 4 sleep. Next, Second one is low levels of serotonin metabolites in CSF. So it has been observed that deficiency of serotonin, right, which is a neurotransmitter that regulates the pain and that regulates the NREM sleep, might be involved in the pathogenesis of fibromyalgia. So the other alternative theory is that decrease in serotonin, right, decrease in serotonin in cerebrospinal fluid, right. So this serotonin, it is the neurotransmitter that regulates the pain, right. It is a neurotransmitter that regulates the pain and NREM sleep. Because of decrease in the levels of serotonin, that also might be contributing to the pathogenesis of fibromyalgia. Okay, next, reduced levels of the growth hormone. See, growth hormone, it is an important for muscle repair and as well as strength. Okay, so this particular growth hormone, it is very important for muscle repair right. It is very important for muscle repair and as well as strength. And this growth hormone, it is secreted normally during stage 4 sleep. Right, this is secreted normally during stage 4 sleep, which is disturbed in patients with fibromyalgia. So in fibromyalgia, the stage 4 sleep is disturbed. So then what will happen to your growth hormone? There will be reduction in the growth hormone. So reduction in growth hormone may explain the extended period of muscle pain following excretion in these patients. So you need to know that because the stage 4 sleep is disturbed, there will be decrease in the growth hormone. Why? Because the growth hormone is released in the stage 4 sleep. So once the stage 4 is disturbed, the growth hormone levels will be reduced. And this decreased growth hormone is the one which is responsible for extended period of muscle pain. Okay, that is another important pathogenetic feature. Next, the another important point is the increased levels of neurotransmitter substance P in the CSF. See, increased level of neurotransmitter substance P in the CSF of fibromyalgia patients may contribute to spreading muscle pain. Okay, so this substance P, whichever is increased, right, this substance P whichever is increased, even that is responsible for the pain, right, even that is responsible for pain in fibromyalgia. Okay, next, followed by that, decreased cortisol response to stress and corticotropin releasing hormone. See, patients with fibromyalgia, they have decreased cortisol response to stress, and there will be low urinary free cortisol and a diminished cortisol response to CRH suggests abnormal hypothalamic pituitary adrenal axis. So decrease in cortisol and as well as decrease in CRH. What does that tells you? That tells you an abnormal hypothalamo pituitary adrenal axis. Right? Abnormal hypothalamo pituitary adrenal axis. Okay, so that is another important pathogenetic feature of fibromyalgia. Next, coming to your autonomic dysfunction. See, in these patients with fibromyalgia, they have autonomic dysfunction, and this will manifest as orthostatic hypotension on tilt table testing. Right, this will manifest as orthostatic hypotension on the tilt table testing. So apart from that, because of autonomic dysfunction, these individuals will also have increased resting heart rate. So there will be resting tachycardia in these patients with the fibromyalgia. And apart from that, because of autonomic dysfunction, these individuals may also have the presence of dry eyes and dry mouth. Right, these individuals will also have dry eyes and as well as dry mouth. Okay, so this is another important manifestation in patients with the fibromyalgia. Next, when you do an imaging in patients with fibromyalgia, there is reduced blood flow to thalamic or thalamus, caudate nucleus and tectum on SPECT scan has been observed. That is single spectrum electrocomputed tomography, right? So that is single photon electrocomputed tomography, that is your SPECT. So reduced blood flow to these areas, that is thalamus, caudate nucleus and tectum. You know, these are the one which are involved in signaling, integration modulation of pain. These structures are affected, and that is the reason why there will be disturbance in the integrating or integration modulation of the pain, and that is what is responsible for the development of your fibromyalgia. Okay, so there will be alteration in integration modulation of pain, right? That may explain why fibromyalgia perceives stimuli such as heat or pressure as the painful with less degree of stimulation than normal. Okay, so because of alteration of the modulation of the pain due to decreased blood flow to these structures, let me tell you, these individuals, whenever they are exposed to heat or whenever they are exposed to pressure, right, they perceive them as the painful stimuli. Okay, and along with that, let me tell you, these patients with the fibromyalgia, they also have psychological abnormalities and psychiatric disturbances. So let me just summarize all the pathogenetic features of fibromyalgia. Number one, disturbance of NREM sleep that has been associated with awakening with unrefreshed sleep. And second, low levels of serotonin. Serotonin is the one which is released during stage 4 sleep, and because the stage 4 sleep, that is NREM sleep, is disturbed, there will be deficiency of serotonin, right? And that is the one, serotonin is the one which regulates the pain as well. And next, reduced levels of the growth hormone. So growth hormone is important for muscle repair and strength, and it is secreted during stage 4 sleep, right, which is disturbed in patients with the fibromyalgia. Next, followed by that, in these individuals, there is increased substance P in the CSF, and that also contribute to spreading muscle pain. And next, there will be decreased cortisol releasing hormone in response to stress, and that suggests an abnormal hypothalamic pituitary adrenal axis. And in these individuals, they will also have autonomic dysfunction, which will present as orthostatic hypotension and resting tachycardia. And when you do a SPECT scan, that will show that there is reduced blood flow to thalamus, caudate nucleus and tectum, because these are the important structures which will integrate the modulation of the pain. So because there is alteration of the blood flow to these particular structures, these individuals will perceive heat or pressure as the painful stimuli, right? Now, let me tell you what are all the various tender points. I said you there are multiple tender points in patients with fibromyalgia, and the pressure what you need to apply is around 4 kg per meter square. So these are all the tender points, right? Number one, the low cervical area, that is anterior aspects of the intertransverse spaces at C5 and C7, right, on both the sides. Then the another important tender point is the second rib, that is exactly at second costochondral junction. And next, lateral epicondyle, that is 2 centimeters, right, 2 centimeters distal to the epicondyles. And the other important tender point will be over the knee joint, that is medial fat pad proximal to the joint line. Then over the occiput, that is suboccipital muscle insertions, okay, on both the sides. Next, over the trapezius, that is midpoint of the upper border, right, midpoint of the upper border, okay, that is over the trapezius. And another important tender point is over the supraspinatus area, above the medial border of the scapular spine. Next, another important tender point is over the gluteal region, that is upper outer quadrant of the buttocks, and over the greater trochanter, posterior to trochanteric prominence. So these are all the tender points over which you need to apply a pressure of 4 kg per meter square, and there will be elicitation of tenderness in these pressure points in patients with the fibromyalgia, okay. Then, so if you take the investigations, that is your SPECT, that is single photon emission computed tomography. That is what is your SPECT. When you do a SPECT, that will demonstrate reduced blood flow to thalamus. Right, reduced blood flow to thalamus, reduced blood flow to the caudate nucleus, and reduced blood flow to the pontine tectum, okay. So these are the areas in the brain involved in signaling and integration and modulation of pain. So that is what is the reason why there will be abnormal perceiving of the painful stimuli, okay. Next, apart from that, you see this question here. Sleep electroencephalographic studies in patients with fibromyalgia have shown disruption of which particular stage of sleep? 1, 2, 3, 4. So it is your stage 4 sleep, which is nothing but your NREM sleep, okay. So if you do the sleep studies in fibromyalgia, have shown disruption of the NREM sleep. Right, so disruption of the NREM sleep. And sleep electroencephalographic studies in patients with fibromyalgia have shown disruption of normal stage 4 sleep, which is nothing but stage 4 sleep, okay. Now, if you observe the sleep pattern, NREM sleep, there will be repeated A-wave intrusions. In these patients, they will have repeated A-wave intrusions. So what does that tells you? That there is disturbance in the stage 4 sleep. So whenever there is disturbance in the stage 4 sleep, right, you have these particular A-waves, and you will have repeated A-wave intrusions. And finally, what is the treatment? Which of the following drugs are not used in fibromyalgia? Cyclobenzaprine, amitriptyline, duloxetine, and steroids. Let me tell you, steroids, they have no role in the treatment of the fibromyalgia. Then what are the agents you need to do? The pharmacological agents effective for the treatment of fibromyalgia includes, number 1, muscle relaxant. And what is the name of that particular muscle relaxant? That is cyclobenzaprine. Right, that is cyclobenzaprine. Now, apart from that, the antidepressants, okay, antidepressants, the one which have balanced serotonin norepinephrine reuptake inhibitors, and these antidepressants, they include, number 1, amitriptyline, then duloxetine, then milnacipran, okay. So these are the antidepressants which also are very important in the management of your fibromyalgia. Then followed by that, anticonvulsants, right? These anticonvulsants, example like Pregabalin, right? So this Pregabalin, it is a ligand of the alpha 2 delta subunit of voltage gated calcium channels. These are also very important in the management of the fibromyalgia. And if you take the analgesics, right, if you take the analgesics, tramadol, it is less effective. Right, tramadol, it is less effective. And steroids, they are not used. Right, the steroids, they are not used. Okay, so this is about your fibromyalgia. So to summarize fibromyalgia, it is the disorder most frequently seen in women of the age group around 20 to 50 years. And there is chronic widespread musculoskeletal pain syndrome with multiple tender points, right? I have shown you the image also where all the tender points will be there. And there will be fatigue, headache and numbness, which is very common. And objective signs of inflammation are absent and laboratory studies are also normal. Only the SPECT scan will show you the reduced blood flow to thalamus, right? And there will be reduced blood flow to the pontine technum, and there will be reduced blood flow to the caudate nucleus, right? These are all these are the structures which play an important role in the integration of the pain modulation. Okay, so with this, we will wind up the session on this very important topic on fibromyalgia. Thank you very much.